I'm alright. For people who are hearing this on a podcast, you missed probably the greatest intro that Logan has ever done, because it was basically a variety of things getting cut. Bananas, cigars, what else was in there?
Logan's an intro savant, y'all.
I don't know what that means.
I don't know what it means either, but I like it and I want more of it in my life. Guys, welcome to the show. Today we're talking about some interesting stuff. I wanted to talk about the doctor in Henry Ford Hospital in Detroit, emergency physician from West India, Gujarat. She speaks Gujarati anyways, according to, there she is, Dr. Jumana Nagarwala. She is one of my people. My parents also speak Gujarati. I think she's Muslim. My parents are not. They're Zoroastrians, but she is part of the Western Indian tribe of Gujaratis. She has been accused and jailed so far on charges of participating in female genital mutilation or removal of bits of the clitoral hood, the clitoris, or the labia. And she has apparently been the victim of She has been caught through an FBI sting as she was boarding a plane to go to Nairobi to visit her children who are in boarding school there. And this is a huge and veritably disgusting topic loaded with all kinds of interesting things, such as cultural norms around the body and healthcare, as well as is there an absolute morality around how you treat girls, women, people, humans, conscious entities? And what does this mean about male circumcision? Is that a bad thing too? What do you think, Tom?
Well, there's a lot to unpack here. First of all, what's the full story on? She's just being accused right now, so what do we know?
So this is what my understanding of the case from reading the press. Now, Henry Ford Hospital is near and dear to my heart because I actually spoke there, did a gig for the residents. They were great people, very diverse group of people and doctors. So I don't know, she might have even been at my talk, Tom, because she's an emergency physician there.
So you're saying that you probably caused this?
I'm going to take credit for female genital mutilation. That's basically what you're accusing me of, and I'm going to go ahead and I'm going to own that. I'm going to own that because some people try to push it off and they go, no, it wasn't my fault. It was totally my fault. By speaking about Health 3.0 in Michigan, I may have caused 2 7-year-old girls to undergo female genital cutting, and in this case, they were young girls that were brought in from Minnesota by their parents, and presumably Somali, I think, is what I understand from the reading. And there's a high Somali population in Minnesota, and in Somalia and in, I think, 29 countries in the world, female genital mutilation or female genital circumcision is still legal and culturally, in many places, encouraged.
So what does female genital cutting, what does that mean specifically?
Right, so specifically, and then we can talk about what happened here, specifically, it's a ritual that has religious, cultural significance dating back a very long time. About 200 million girls in the world have underwent it. That's the current prevalence of it. And what's involved is the external genitalia of the female anatomy are tampered with. So either you can cut the clitoris, you can remove it, the actual glans clitoris, the clitoral hood, the skin covering the clitoris, the labia minora, and the labia majora. You can do all kinds of damage to those organs by removing them, cutting them, mutilating them, etc. And you can also close the vaginal opening in a way that culturally apparently protects you from sexual promiscuity, as does removal of the clitoris. So the idea is to keep girls pure until they're married. And unfortunately, you remove, in many cases, the female ability to have orgasm if they're having solely clitoral orgasms. You're removing sensation. You're also potentially creating problems with menstrual flow, with urination, with infection, with scarring, et cetera, et cetera, et cetera, et cetera, et cetera. So the countless negative effects of this can be enumerated for a long time. On top of that, often this is done in any time from neonatal period all the way up into puberty, and it's done often without anesthesia. So it's tremendously traumatizing and painful, and women have told stories over the ages of how horrifying it is. At the same time, women in these cultures a lot of times will insist on it for their own daughters because of the stigma of not having it, of the idea that the daughter is not pure, and their morality censors are based around this idea of sanctity and purity, and the violation of that is actually a violation of the code of society. So you have to look at that as well in terms of what's driving this behavior.
Sounds like it's a violation of the code of Hammurabi, because this seems like a fucking ancient idea.
Dude, you just cited Hammurabi in a podcast webcast, dude. Like, the code, baby. An eye for an eye, a clitoris for a clitoris. Is that what it is?
This is some ass backwards thinking to circumcise females.
Well, so that's what I think 100% of rational, enlightened, scientific age people would say. I think the counter argument, and I'm just going to make this once because then I'm going to say how incredibly stupid and wrong it is. The counter argument is, again, this is a deep cultural tradition with a lot of roots in the morality of that particular culture. Be it African, Asian, Middle Eastern, is where it typically settles. And so there are reasons to do it that are cultural. There is no proven medical benefit or scientific benefit to female genital mutilation, and a ton of downside. So from a scientific standpoint, it makes no sense. Now, now the question then, Tom, is there an absolute morality that transcends culture?
100,000 million % there is.
So you, me, and Sam Harris would agree that that is the case, that there is an absolute morality, and it has to do with alleviating the suffering of conscious entities or improving their well-being. And female genital mutilation, really for the girl in question, except for the societal benefit of fitting in, has no perceived, that I can imagine, perceptible benefit.
No, there's no benefit. And it's horrifying that this happened in America. That's the part of the story that's most shocking to me.
Well, the interesting thing is, this has been a law that you cannot do this in America for quite some time. However, no one has ever been convicted under this law yet. So female genital mutilation is illegal, but this woman was also charged with sexual trafficking because moving girls across state lines to undergo sexual abuse, which this was defined as inappropriate touching of female genitalia, because that's what they defined it as, was part of the charges. So this is a first in terms of conviction. Is it the first that this has happened in the U.S.? If you think that, you're probably crazy, because probably this has been going on for a while. Remember, she was caught by some FBI tip. Who knows who tipped off?
Right, yeah, I'm not saying first time. I'm saying, right, first big case with a doctor.
Right. Well, I think the thing, the reason this is so shocking to us is that it's a physician practicing at an academic medical center who's an emergency physician. And she did this outside of that center, so that center is not, again, has nothing to do with this. Henry Ford, again, I've been there. It's a fantastic place, and the residents work really hard, and the docs there are passionate. And but in this particular case, she's taking this training. She trained at Hopkins, I think. And again, she's Gujarati. She's from the place where my parents were raised. So there's some connection even I have. But I look at her, if this is true. Now, let's back up a second. This is a doctor, a professional, one of our tribe of health caregivers, who is being accused of a crime but has not been convicted. So we have to really make sure that we understand that these are still allegations. And apparently her statement to the lawyers is, no. She did a procedure where she removed a mucous membrane. It's a ceremonial thing in certain religious traditions in Indian Muslim populations. And that was her defense. Personally, I think they examined these girls. They found that there was labia minora removal. There was damage to the clitoral hood. That's legit female genital mutilation if we believe the reports that we hear. And again, this is all third hand. So first of all, I want to say she hasn't been convicted. But second of all, if she gets convicted, this is absolutely the worst effing thing you could ever do. It's an abuse of your pact to do no harm. It's an abuse of your reputation and your trusted role as a caregiver, even if the parents wanted it, which apparently they did because they flew them over. And they told these little 7-year-old girls that they were going on a special girls trip and they were going to visit the doctor for their tummy aches to get the germs out. And then, boom, betrayal, cutting of the genitals. The girls described all kinds of terrible symptoms of pain, bleeding, etc. They gave them pads to wear. They told them, don't tell anyone. Like, if this is true, it sounds like any other kind of sexual abuse, doesn't it?
Yeah. It's worse than other sexual abuse.
Vastly.
It's permanently damaging.
Well, it's done by a trusted figure, of course.
That too, yeah.
Catholic priests have been doing this forever, but I think that in this case, it's particularly a betrayal of our tribe of healthcare. And I think that's why it hits such a nerve in most people. Also, I think we're advancing as a people across the globe. So genital mutilation is becoming less prevalent. It still exists. It's still a huge problem. But it's becoming more and more a sense of moral outrage when it occurs. And, I'll tell you, there will be apologists, cultural apologists for the subsets of the cultures that approve of this kind of behavior, saying, well, their culture is just as right as our culture. We allow male circumcision. The Jewish culture insists on male circumcision, et cetera, et cetera, et cetera. How are we any different?
True. Except male circumcision rocks, bro.
It totally rocks. Let's get into that. Okay, first of all, let's wrap it up on the female genital mutilation. Never okay, a crime. If this woman is guilty, which again, we have to give her benefit of the doubt until she's proven guilty, she should rot in prison forever and ever. And have her license removed and all the other things. Now, if it's not true or there's something we're missing, it should come out quickly and she should be vindicated. But all that being said, nothing okay with this. And culturally, there are a lot of things culturally that you could say they were cultural things. Slavery in the South in the 17 and 1800s was a cultural institution, right? It was the peculiar institution of slavery. Does that mean it was okay? Does that mean it was morally good? Absolutely not. So it's the same with female genital mutilation. Now, when I posted this article a week or so ago, when it came out 5 days ago, I got a lot of comments saying, yeah, you know what's horrifying is male circumcision. This is a crime against the penis, and nobody is stopping it, and the American Academy of Pediatrics is promoting it, and it's based in superstition and religion, and there's no grounds for it, and so on and so forth. And what's interesting is the people making these comments were female, which I thought was interesting. Of course, that's not exclusively the case, but what do you think about this male circumcision thing? Are you circumcised?
Hell yeah, bro. America. Minjia Own says, misogyny is so evident in the words you speak. It's okay to harm a male, but not a female. That's misogyny to say
I think
it's
that's
okay
the
to harm
opposite
a
of
male?
I think that's the... Wait, are we saying it's okay to harm a female but not a male?
What? I don't think male circumcision is a harm.
That's not harm. Okay, so here's the thing. This, male circumcision, is a very charged emotional topic for some people.
Listen, people, I'm circumcised. My dick is working great. Overtime, in fact.
He is the D word on my podcast, which I think is amazing.
My phallus.
Your prepuce.
My penis.
Listen, I like to think of it this way. Would you rather have me like this, or with a few simple interventions when I'm young with anesthesia, using pain control as an infant, if you do this? A lot of things happen. Some are beneficial medically, some are neutral, and some are cultural, some are religious, etc. What may not happen is significant harm unless there's a complication of the procedure, etc., etc., etc. So should we just go through, should we go through the risks and the benefits of male circumcision? Because I know people are going to get pissed AF.
Before we go through it real quick, Molly Smith says, but it's cosmetic without consent. Why not wait till the boy can consent? Quick story time. I had a friend when we were in middle school who was so embarrassed that he was about to start to become sexually active in high school with, the opposite sex, and he was uncircumcised, that he got himself a circumcision, and he was in agony for weeks. It seemed like the most painful thing I'd ever seen.
My penis hurts just talking about
it.
And
he had to beg his parents to get a circumcision because his parents were European.
Well, now, in that case, you could argue that he was being pressured by the same cultural pressures that might pressure females to have genital circumcision in the countries where it's encouraged. So that's really a cultural press. But the fact of the matter is there are potential benefits to circumcision. And you can come out neutral, you can come out pro, you can come out con, but in general, the benefits are, especially in infants, young children, reduction in UTIs, okay? Because the prepuce, the skin, the foreskin, can collect bacteria and flora that can track into the urethra and cause infection. It's rare, though. It's rare, so it's not a big deal. The other advantage is penile cancer reduction, because a lot of times the penile cancer occurs in the foreskin tissue itself. Cervical cancer, so getting HPV in the foreskin and then transmitting it to a female partner, can actually be a higher rate of transmission in patients who are uncircumcised, who have foreskin.
Right.
And then the reduction in STDs, including HIV. And there's a lot of theories for why this is. Some is that the foreskin tends to get abraded and be a portal of entry for HIV. Some are that foreskin cells have special receptors that bring HIV in. But there is documented reductions in HIV transmission in populations that are circumcised relative to uncircumcised in studies in Africa. So this is a real phenomenon. In addition, and many nurses bring this up, when you get older and you still have your foreskin, it can get inflamed, hygiene can be an issue, and then retracting it can be a problem, in which case you get a phimosis or a paraphimosis and you have to have an intervention. So urologists deal with this and see this, and a lot of nurses, if you have, or CNAs, if you have a congestive heart failure, other swelling, you can actually have problems where the foreskin becomes a real issue. In addition, the question is, does it increase urinary tract infections in older people, people with Foleys, et cetera? And I don't know how well that's been studied. And then just in general, having easier hygiene, if you want to become a porn star, you pretty much have to have your penis circumcised. And to me, that was why I did mine. Because I was like, I want to keep all my options open. If I want to move to the San Fernando Valley and make it happen, okay, I don't want to have this done as a teenager. I'm going to do it now as an infant. I made that decision as an infant because I was ahead of the curve, you know what I mean? But this idea of like doing it against the will of the child. So in other words, there's a lot of comments that say, holding anyone down and cutting them is insane, but if they're of age and willing, well, Molly Burgess, I mean, as an infant, obviously they don't have decision-making capacity, right? They can't make a decision. But the thing is, so Logan, you had to make this decision for your child recently, Landon, who's now what, like 9 months?
Yeah, he's 8 months.
So what decision did you make? Which way did you go?
So actually, right off the bat, like immediately, I didn't even hesitate. I was like, oh, of course we're going to circumcise him, And then somebody actually on Facebook had posted this big thing about how circumcision is terrible and it reduces male sensitivity in the penis and stuff. And so I started like doing all the research I could. I asked the pediatrician, and they kind of gave me it's just cosmetic.
Yeah.
And I'm like, well, I found these articles that say this and this. It's like, I can only tell you it's cosmetic.
You Dr. Googled it.
Yeah, Dr. Googled.
Yeah.
So yeah, we ended up. My wife was actually the one who ended up kind of being the.
Yeah. She pushed it.
Because I was either way.
Yeah.
I'm like, okay, maybe not. And she was like, no, I don't want him to have a weird...
Oh, how interesting.
A weird wang?
Wang.
No, so this actually, so the decision-making process is multifactorial. It's whether the father was circumcised. That has a huge influence because dad then says, no, absolutely, I want it because I got circumcised, or no, I'm not circumcised, so I don't care, or maybe don't do it. Social pressure from family, so wife, other family members, and then the weighing of potential health benefits and risks, right? So it's interesting. Now this idea of the downsides of, and I think, by the way, the pediatrician did not do you any service by saying it's cosmetic.
Yeah.
I think there's a lot more nuance to it, and they should have given you both sides. Now the other side of this, guys, the potential disadvantages, this is what's listed, okay? And again, you kind of have to look at this. So obviously there's complications. So anytime you do a procedure, you can have complications. Those complications can be inadequate skin removal, bleeding, infection, damage to the urethra, including fistulas. So, abnormal connections between the urethra and the skin where it's not supposed to be, injury to the glands, removal of excessive skin, different cysts and adhesions, skin bridges, all kinds of things like this, but they're rare. So in 200,000 circumcisions, they did a couple studies, they found a complication rate, and these are all complications, of 0.2%, so 400 out of 200,000. Now that's not zero. So if your child is that one, that could be a problem. Now what I didn't see in these studies is who was doing the procedures. Do you let, a priest or a mohel or somebody else do it, or do you have a skilled operator, be it a pediatrician, an obstetrician, a urologist, whoever's doing the circumcision, do the procedure? Obviously the more you've done, the better you're going to be at it. It's true of anything. So actual physical complications of the procedure itself, but then the idea of sexual dissatisfaction, so the idea that the foreskin contains a lot of sensory receptors. And now, here's the problem. You, me, Logan, we don't know what it's like not to be circumcised.
Right.
So I'm sure we all are like, yeah, it's cool, whatever. Like, I have a penis and it works. The question is, could we A/B test ourselves pre-circumcised and go, oh man, this is a lot better having foreskin? We can't.
Well, some of the guys in the comments have done it later in life. So if you have A/B tested it both ways, tell us which one's better.
Right. Now the thing is, remember what happens. So this is one of the theories. If you're circumcised, the skin underneath, the actual penile skin, gets keratinized. It gets thickened, right? So the idea is that there's reduced sensitivity. There's also there's a greater barrier to infection, to injury, etc. So if this is true, then over time that might get more keratinized, you might have less sensitivity. There's a lot of different ideas. We got to get a urologist on to talk real dirty about it. But this is one of the theories and the ideas behind it. So could this be a problem? Are we committing a crime on young kids by depriving them of the choice to do this and maybe affecting their sexuality? Now, a lot of people would argue the last thing a penis needs is more sensitivity.
I would argue that.
Right?
I think it is a blessing for young males to decrease sensitivity. It is a great service you've done them.
Thank you for circumcising me, because now I can go more than a minute without, but no, I mean these are serious concerns, sexual, and then the question of like the pain at the time of the circumcision. Some people really equate this to female genital mutilation, where you're causing trauma and pain and permanent scarring. But Logan, they gave your kid pain control locally.
Yeah, I think of it like Novocaine or something.
Right. So now it used to be there was nothing you could do. Now there is, right? So you can do dorsal penile blocks, you can do these rings, you can do topical lidocaine anesthetic creams. There's a lot of stuff you can do that can reduce the pain. But now, Logan, you said that your kid was a little upset for a month.
Yeah, so he immediately, that was the loudest I've ever heard him shriek. And you can hear it throughout the whole hospital.
Yeah,
wow.
He chopped off part of his dick, too.
Yeah, I kind of felt like a bad parent for a month after that. Because like, for a whole month, there's just any time like that thing touched anything, he was just...
He was tender. Yeah. And when did he was circumcised? Like what, day 2, day 3, something?
Actually, it was where the insurance wouldn't cover. They don't do it in the hospitals anymore, which is what we found out because I was circumcised in the hospital when I was born.
Right.
But I guess they can't do it now for insurance reasons or something.
Got it. At least in this climate.
Yeah. So we did it. I think it was closer to a month.
Okay, so he was a little older too, yeah. It's tough to know, and I want to get Dr. Harry on the show because he performs circumcisions, but he's actually equivocal about the whole thing. He doesn't feel strongly one way or the other, and he's, of course, a pediatrician. But so, I mean, again, and it's kind of very similar to the vaccine thing. Like when you give your kid like 5 vaccines at once, a lot of people feel like terrible parents because the kid's screaming for a while and they have a fever and they get that kind of thing. But I think in this case, the benefits of circumcision are less aggressive than the benefits of vaccination.
I've always sort of wondered about how male circumcision may affect, acting out sexually or porn addiction, because maybe they're seeking extra stimulation. I don't know. I mean, I always wondered about that because that's a problem in my generation is like porn addiction. These dudes are really into the computer and like they can't interact with a real girl, that kind of stuff.
Dude, tell me about it. Every time I pick up Tom's phone, I can't. It's just not okay. No, but actually, all joking aside, this is a problem. Internet overstimulation with images, and the question is it? What Tom is asking is if you did a trial, not a placebo-controlled trial, but 2 groups, uncircumcised, circumcised, and you examine them for signs of internet addiction, overuse of porn, desensitization, etc. I think that's a trial that I'm not sure has been done. It might be really interesting. Who the hell's going to fund it? It would have to be a publicly funded trial because no pharma company cares. Speaking of which,
YouPorn should fund it.
You know what? If YouPorn funded it, by the way, I have no idea what YouPorn is. I don't know what he's talking about. No clue what he's talking about.
You know that Harvard was trying to find some guys who had never watched porn for a study. They couldn't find a single one. Exactly. I mean, in my day, it was like sneak somewhere, find a Playboy magazine in a brown paper bag, right? Now it's like click, 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 click. I mean, from the minute you hit puberty, you can pretty much access the world's wealth of porn, and that may not necessarily be a good thing. Ryan Brower says, what bugs me is when anti-circ mothers bring their little children in to be seen at my clinic and don't clean their boys' prepuce. Some of these mothers don't want to touch my kid inappropriately, and so the kid gets infected or irritated area, and these moms don't know what to do. We end up having a big, uncomfortable discussion about moms' needs to take care of their boy's penis until they can take care of it themselves. If you're going to insist on non-circ, keep your kid clean.
Yeah, dude. If you don't chop it, you better wash it. You know what I'm saying? Well, this is true, and this is an education issue, so I don't think it's a strong argument to circumcise. And again, I think if you're asking me really what I think, I'm equivocal. I think it's a cultural and a social and a personal decision that the parents end up making on behalf of their kid, and whether you think that's wrong because the kid doesn't have agency, I think there's enough benefits that I think it's not the wrong decision to make for your child. It's also may not be the right decision. You don't have to do it. I wouldn't pressure a parent one way or the other, but I would give them all the information on both sides and say make a decision based on what you feel comfortable with.
The interesting thing is like we are all saying like, yeah, circumcise your baby boy as soon as they're born. But I know you, Z, and I know that you would never let your girls get their ears pierced when they were babies.
Dude, I would have pierced their ears. What are you talking about? They're little Indian girls, man.
What?
They get everything pierced.
No, you wouldn't have.
No, you're right. No, I wouldn't. But I think that's just because I don't see any. It's purely a cosmetic thing and a cultural thing. And little Indian girls, they get their ears pierced very, very young. But my wife being Chinese, you guys met her last week, she was like, no, you're not piercing my kid's ears. And I was like, that's cool with me. I don't think we need to do that. But honestly, and I don't think anybody's saying go, circumcise your kids. But I think I would push back on people who are very highly anti-circumcision, and I just don't think there's a lot of evidence that that's a valid stance. Now, if you're anti-circumcision because you're anti-religion and you think it has a religious basis, then that's a stance you can take, and you can say it's unscientific. But the thing is, there is some science for male circumcision. And you can argue the science, of course, like you can argue anything, and even anti-vaxxers argue science and try to make points. So
Catherine Laney says, do whatever Dad has done. That way he knows what to do with it, hygiene-wise. I kind of feel this way because if I chose not to circumcise, I would be like, I don't know, wash your dick and do some stuff. I wouldn't know what to say to my son. I'd be like, you scrub it.
It's really great having such a high-level scientist on the show as Tom Heineberg. Scrub your dick. I don't know. No, but I mean, honestly, part of the fun of Incident Report is speaking in the colloquial, because honestly, I think as doctors we tend to be very formal. My feeling is, look, make the decision that you and your family members are comfortable with. Now, Tom, have you ever met a well-adjusted person who is normal in the head who wants to have foreskin reconstruction?
Hell to the Nazi.
No comment. I'm just saying. So there is foreskin reconstruction that you can do. You can rebuild a foreskin. It's like the Bionic Man, except they use forearm skin because it's very sensitive, and you can recreate it. Now, some people really are passionate about this. It doesn't quite make sense to me, but maybe I'm missing something. Anyone who's had it done or has known someone who's had it done, leave a comment, let us know, and we'll look at it. It's very different than, say, female genital mutilation reconstructions. There's a doc in Germany who does this because there's a huge population from Africa that's had suffered female cutting, and they come to her often in secret to have reconstructions because they're so embarrassed, and now they're in a Western culture and they feel, like nobody thinks they're beautiful because they've had this procedure done. It's really quite tragic. So she tries to help them. There was an article on her a while back. I'll try to dig it up for you guys.
Well, okay, okay.
Tom's at a loss for words. That's unusual.
What is a vaginoplasty?
So vaginoplasty, and I'm not a plastic surgeon, but it's a reshaping, remodeling of the vaginal walls, of the exterior, if I'm understanding correctly. And the idea is to change some perceived deformity, roughness, discomfort, etc. And it can be a smoothing. And again, you'd have to watch the show The Doctors, because one of the plastic surgeons on there talks about vaginoplasty quite a bit.
Is that not sort of a form of female circumcision?
I think this is very different, because this is done with female consent, usually adult females, and it's done because there's some concern with either aesthetics or function. So that's the difference. Like, I don't think these young girls in Africa are concerned with aesthetics or function. They're concerned with fitting into society, which to some extent is aesthetics, right? But it's not necessarily personal aesthetics. And so, well, there can be. And so there's a difference here. And I think the other problem is, again, no scientific benefit to female genital mutilation, and a lot of downside. And this woman in Germany sees the downside all the time, this doc in Germany who does these procedures.
Logan's about to do a thing.
What's he going to do? For the podcast people who can't see this, Logan's fist is in the air, and he's put up a subtitle saying, "All vaginas are beautiful." It's true. It is true. Everyone is a snowflake. Let's go through some comments.
Logan's a strong feminist, y'all.
Very much so. Sonoy Faulu Hall. My own husband said he's glad he's circumcised. He's had too many friends get severe infections because they didn't clean properly. I've seen many men get circumcised later in life. Right. Now, again, that doesn't change it from being a personal decision and one that, could be made later in life. It's just, as Tom had said, it can get a little complicated. Elizabeth Chickentally says, "Thank you, Logan, for the vagina thing." Logan is thinking, you're welcome. Miriam Champer, it's not just aesthetics. There are docs who try to expose erectile tissue for women who had their clitoris cut. That's exactly right, Miriam. So, I mean, again, if you can actually get into the spot where there is still sensitive tissue, expose it, and allow the woman to have more pleasurable intercourse. So this is a thing, and it has a purpose.
Allie Berger says female circumcision is misleading because it suggests it has the same benefit as male circumcision. It should just be called female mutilation instead.
Right. So when you use it, and words do matter, guys. When you call it female female circumcision, it does. It applies a scientific sort of equivalency, a false equivalency to male circumcision. So we'll call it female genital mutilation from now on.
Maureen
Thanks for
says,
correcting me.
do men not shower? I don't, Maureen.
Yeah, you don't understand. Tom hasn't showered in like 4 weeks.
I couldn't be uncircumcised.
It's just not a thing. It's not a thing. Tom, you have to pull up the comments because for some reason mine are not streaming right.
Okay.
Yeah.
Let's see. Samantha Reed says, a blind patient of mine who was over 60 asked me if he could get a circumcision because he couldn't see his foreskin anymore and didn't know if it was clean.
Wow. So he could have had a 5 skin and not even known it. That's amazing. I'm here all week, people. Tip your nurse. No, I mean, this is the thing, because as you get older too, the self-care becomes difficult. If you look at a older patient's feet, you can see already the nail care is difficult, vision, sensation becomes hard, and so, no pun intended. And so with the penis, there's no exception there. I want urologists to write in. I'm gonna have to get those guys in Florida back on the show and have them talk about it, because I'm sure they have some opinions both ways on this.
Mary Ann says, I had sex with someone who was circumcised and someone who wasn't. How about female pleasure? I did not like the uncircumcised. Just saying.
2 other comments that said that as well.
So we have a total of 3 comments from women saying that uncircumcised penises were worse from a pleasure standpoint.
Colloquially, at the bar, I have heard the opposite also sometimes, that uncircumcised is better.
Interesting.
More friction.
Well, but the foreskin is very soft. So it's interesting.
I don't have a vagina. I'm just telling you what I heard.
There's no proof that you don't have a vagina, Tom. I've never been shown proof of this. Here's the thing, though. It is a cultural sort of bias, I think in general, towards circumcised. That's why I think the porn industry tends to have circumcised penises, although the porn industry is not aimed at females. The porn industry is aimed at men. So maybe it is that men don't want to see. 80% of U.S. males aged 14 to 59 are circumcised. That means that the cultural prevalence is circumcision, which means to see a penis that doesn't look anything like yours may be tricky in a pornographic setting.
Erilyn Gomez says, uncircumcised, he feels more friction in his own skin. We feel less as a result.
That would be my theory, but again, I can't comment on it, and I'm not a sexpert in any way. In any way.
Francie Darnell says, I like uncircumcised better, just saying.
There you go. There you go. And now the world knows, Francie. So
circumcised is better. Elizabeth Ann, oh my God, it's like a cultural war.
Oh, we started a culture wars. Logan loves culture wars. This is going to be perfect. I love it.
Carrie Bennett says it looks like a grub worm. That's rude, Carrie.
So here's a funny story. Not really. When I was a kid, when I was probably 5, 6, 7, I don't remember how old I was, but like I had a friend who was the same age, and we were in New Jersey because that's where I grew up. And I remember we were peeing behind like a tree in the forest because we were like, oh, let's go take a pee outside. And I took a peek over there because I was curious. I was curious Z. And I was like, what's up with other pee-pees? Do they all look the same? And I recoiled in horror because this was, I think it was an Indian kid, totally uncircumcised. And I was like, ah! Like I'd never seen anything like that because I'd only seen my own. And so there was my elephant was immediately disgusted.
Well, interesting story. I heard a story recently about a friend's younger sister who's about 15, and she had her first sexual encounter with a boy, and the boy recoiled because she had a more pronounced, like, sort of labia majora, and he'd been used to seeing porn, and he wasn't used to that, and this like broke her, and was a very traumatic experience for her. You know what I mean?
So this has come up again and again and again, and women are having labiaplasties where the labia are reduced and all these things because, again, of this societal expectation that everybody looks like a freshly shaved runway and it's all perfect and all of this. And unfortunately, or fortunately, humans aren't like that. So this is actually a tragedy that we need to address. I think some plastic surgeons take advantage of this, because they don't have the conversation like psychologically, what's going on? Listen, your vagina's fine. There's nothing you need to do to it, right? And it's just like I've had 4 or 5 botched penis reduction surgeries because every time I'm like, it's too long. Like, it's just too long. And so I had to go through all this myself.
What's interesting I think this is very charged in our culture because of the bottleneck of high school. This is really a big deal only when you're in high school.
Yeah.
The rest of the time, but that formative experience really, really, sinks that feeling in deep.
How many of us were just had these experiences in high school where you're just like, okay, and then you become weird for the rest of your life, right? I mean, the high school is
You feel like you're on a stage in high school. Like there's a spotlight on you and everyone's watching your every move.
You know, the worst part is at one point I was on a stage physically in high school when we did this band thing, and I've never been that scared in my life because, again, it's this fight or flight. My entire reputation, my whole worth as a human being is on the line because my peers are judging me, and that's how it feels. That persists through life, I think. Humans are that way, but it's worse in high school by far.
Catheters for circumcised are easier than uncircumcised.
Yes.
Benjamin.
Yes, this seems, many nurses have said this, and it's funny, I have to give the credit to the nurses for this because the last time I placed a Foley was sometime in residency, and I suck at it. The nurses do it 1,000 times better. I usually just put it in the wrong hole, and that's for the guys. Like, I'm like, how did I get it in this guy's butt? I don't know, but it kind of looked like a penis. No, but it's true. A lot they've said, and especially because you have to retract and it's a little more logistics. But hey, that's not a reason not to, it's not a reason to circumcise, but it's just an observation.
True.
Yeah.
Yeah.
Are we done talking about penises?
Oh man, I've talked about penises so much, Z.
Any more comments we want to read?
Let's see. Chrissy Taylor says, as a woman who has dated both uncircumcised, it is much better. Extra slide action is very noticeable. Unless they are wearing a condom, then there is no difference.
Wow. Well, I guess I'll just go ahead and...
Graphic.
This is called a foreskin reconstruction metaphor, people. It's a metaphor. Other comments?
Let's see. Men that aren't circumcised usually don't know they had easy infections until they transfer it to the woman. That's from Christina. I don't know if I followed that entirely.
A lot of infection, things like chlamydia, etc., the male may have no symptoms. HPV, male may have no symptoms, but they can transfer to females. So again, the cervical cancer thing,
Matt Phillips says, way too much information tonight. Matt, come on, you're a medical professional.
That's true, he is. But he's a cardiologist, I don't think it counts.
Let's see. Allie Berger says, I've recently seen a couple of news stories of Muslim doctors performing female genital mutilation at the request of the child's parents, who are also Muslim. Is female genital mutilation as a medical procedure in the United States illegal?
Yes.
And if not, should it be?
Yes, it is. In the U.S. it is. And there was a interview with, I think, Harry Reid, who had pushed the legislation through, I forget if it was in the 90s or the 80s, because he had seen stories about female genital mutilation and decided that this should be illegal in the U.S. So it is illegal in the U.S. That's why, in fact, probably the reason that this doctor is being indicted, because of the law around it. Now, it wasn't always illegal, and there are some countries where it is not illegal, so doctors can perform it. And then here's a question, Tom. If using anesthesia and doing it in a humane way, still without the consent of the young child, is it okay in a medical setting?
I would say no.
I would say no.
But for dudes, yeah.
Well, we have a double standard.
Right.
But the thing is, there's a difference scientifically, right? They're not equivalent. And people who imply a direct equivalence between the two, I think, are missing the science.
Wouldn't the equivalent of a female circumcision to a male be cutting off the head of the penis? Like, since you're cutting off the clitoris?
So actually, that's a really good point, Logan. So the thing is, it's a continuum of procedures in female genital mutilation. So you can remove the whole clitoris, or you can remove part of the clitoral hood, you can remove the labia, you can sew the vaginal orifice closed. So it depends. If you remove the clitoris, it's like removing the head of the penis. You're right. Which there is no equivalent procedure short of a Lorena Bobbitt.
Yeah.
Right?
I would argue that it's worse because you're losing valuable inches. You know what I'm saying?
Oh my God.
Wow. Yes. Some measured in inches, some in millimeters, some in centimeters.
Julia Navarro says, does current science support that, Z-Dog?
The lack of equivalency between male circumcision and female genital mutilation?
Yes.
Yeah, I think it does. I think there's plenty of evidence to say that reduction in HIV transmission, penile cancer, the reduction in urinary tract infections, and the downside being the complication of the procedure, potential scarring, and the potential loss of sexual sensitivity, which is also, again, since it's hard to do an A-B comparison, it's hard to quantify that.
Let's see.
But with women, it's quite clear.
Melissa Law says, I don't understand why some women are saying circumcise is better. For one, it's the man's body. Lord knows we'd pitch a fit if men started saying that women look better with shaved vaginas. That's a very true double standard.
She's absolutely right. You cannot argue with that. All vaginas are beautiful, Logan. What about all penises, Logan? Give us that. You know,
all penises are not beautiful.
That's true. None of them are beautiful. If you ask
Although
me.
I do have what we refer to in the business as a pretty cock. Back to you, Z.
I as usual, speechless in the face of pretty genitals. All penises are gross. That's right. That's a hashtag, Logan. Thank you for putting that up for the podcast, people. Any other thoughts? Any parting shots? Any other comments that are awesome? These comments are great, by the way.
Let's see.
Love me the Z-Pack. Is circumcision Health 3.0 compliant? That's a question for me. So in other words, is it okay to circumcise in a Health 3.0 environment? Except mine. I hate you guys so much. I really do. I really do. It's like this guy. Oh, I wanted to show you guys something before I forget. So I was researching this incident report by looking at news articles, because that's what I do. And I wanted to show you this. So I wanted to get the Indian perspective, because this doctor, Jumana Nagarwala, she speaks Gujarati. She's apparently from West India. The India West newspaper, which bills itself as the best Indian newspaper in print and online.
Boom.
Also the only Indian newspaper in print and online. But no, I'm kidding. This is what's great. You read the article. It says, Detroit doctor arrested for performing genital mutilation on 2 girls, and it says Indian American doctor. She's a U.S. citizen, by the way, and trained at Johns Hopkins. You scroll down here. Look what they have at the end of the article.
Lower. There you go.
There it is. It has like a pain scale. What is your reaction? Happy, sad, angry. It's basically like pain is the 5th vital. But for journalists, it's like, well, go ahead, zoom on that. What is your reaction to the tag genital mutilation and Jumana Nagarwala? You tell me, Z-Pack. Give me your emoji right now, and that's how we're going to end this. Leave how happy, angry, sad, amused, excited, or unmoved you are. And on that note, or scrote, as the case may be, since we're talking about this, I think we're pretty much ready to be out. Yo, what do you think?
Thanks for hanging out and talking about wangs with us, Z-Pack. Love you guys.
I hate you so much, Tom Heineberg. I'm